Today, I am going to perform assisting insertion of intravenous infusion. First is, we're going to identify our client and introduce ourselves. So, sir, good afternoon. I am your student nurse Laika. May I know your name, sir?
Zen Alex Torda.
After verify our client, we must explain the procedure to our client. So, sir, today matakod ako sa imong intravenous fluid, which is the NSS solution. Make sure that the client clothing or gown can be removed over the IV apparatus if necessary. Since our patient is wearing a hospital gown, it is easy to remove IV apparatus. Next is gather equipment and bring on the beside of the table and perform hand hygiene. Next is we're gonna perform and open the infusion set. Next is we're gonna remove tubing from the container. Next is we're gonna slide the tubing clamp along the tubing until it just belongs to the drip chamber. Leave the end of the tubing covered with the plastic cups until infusion is started. We're gonna spike the solution container. Remove the protective cover the entire side of the bag, which is this one. So we're gonna remove this. After removing the cover, so we can dispose this. Remove the cap on the spike and insert the spike on the insertion site of the IV insert of the IV fluid. So this one and we can apply the medication label on the solution container, which indicate the information about our patients. Then remove the protective cap and hold the tubing over the container. Maintain the sterility of the end. Next, release the clamp and let the fluid run throughout the tubing until the bubble is removed. Next is to recap the tubing and replace the tubing cap. Maintain tubing cap and maintain the sterile technique. Next is we're gonna put our gloves. Next is we're gonna put the tourniquet. Then, we're gonna clean the venipuncture site with the typical alcohol swab. Using a circular motion, so we're gonna use our IV cannula with the gauge 24. So and then we're gonna check if there's a black backflow. Then if we're gonna remove the and then disseminate and then push the end of infusion on the catheter hub. So we're gonna remove the cap. Next is we're gonna initiate the infusion slowly by opening the tubing plug, and the drop will be depend on the doctor's orders. So is we're gonna use the three micropore strips. So first is we're gonna put under the catheter hub. So next is we're gonna add the padded arm board. Next is we're gonna label the tubing with the date and time attachment on the initial, and then document the relevant reports such as date and time of the venipuncture, the time started infusion, the flow rate, the amount and type of solution used and any additives, the type of gauge and needle or catheter, the venipuncture site, and the client response. Next, after putting all the data, we're gonna do the hand hygiene. So first, we're gonna take off our gloves and perform hand hygiene.